Biosimilars. Why should patients care? First, while biosimilars are just as safe and effective as the original biologics they copy, it's really important to understand that they aren't generics. That is, they aren't exact copies, they're highly similar. They compete with the original versions on cost, which theoretically at least creates savings for our health system. So, your health insurance, public or private, may want to switch you from what your doctor prescribed to the version that they're getting the best deal on. But a lot of patients have to try several different products, all safe, all effective, sometimes over years, to find the one that works best for them to stabilize their condition. That was certainly the case for me with my psoriatic arthritis. So physicians generally don't like to make any medication change unnecessarily because they don't want to risk losing the stability that we all worked so hard to achieve. So whether you're starting with the original biologic and switching to a biosimilar, or maybe you're starting with the biosimilar and moving to the original biologic, or maybe you're starting with biosimilar A and moving to biosimilar B, you personally may just respond better to one of these products than another. If you are switched, it doesn't mean you're going to have a problem, and most patients don't. But as with any medication change, you should let your doctor know if you do notice anything different, because biosimilars aren't generics, and they can't be substituted at the pharmacy, just like generics. Generally, if your insurance wants to switch you to a biosimilar, they have to get the doctor to write a new prescription. This is the law in every U.S. state and in most advanced countries, for example, Western Europe, although there are some exceptions. Interestingly, in the US, we do have a special class of biosimilars called interchangeable biosimilars, where the pharmacy can switch you without your doctor's involvement. That's because interchangeable biosimilars have provided extra data to the FDA, sometimes including switching studies, to demonstrate to the FDA's satisfaction that patients can switch back and forth between the original and the biosimilar without any loss of safety or efficacy, compared to a patient who didn't switch. But there's a big legislative push right now to require the FDA to classify all biosimilars as interchangeable, so insurance companies would be able to substitute them without physician involvement, just like generics. There's also a push to weaken the data requirements used to show that switching can be done safely. A lot of physicians and patient advocates, me included, who supported the laws that permit only interchangeable biosimilars to be substituted at the pharmacy, think that this is a really bad idea and feel kind of betrayed, honestly, as it's kind of a bait and switch. In addition to risking the treatment stability for me and millions of other patients, speaking as a patient, I can see it really undermining patient confidence in biosimilars, and I don't think that's a good thing either.